One of the barriers that Heather or any carer might experience is from the bedside manner of the medical practitioners. The way that that patient is spoken to has to be in an empathetic way.
Just introducing things in a personal, compassionate way, respecting the person that is the patient. For a proud person to suddenly need a walking aid is a huge step. So introducing these things in a very compassionate way, being able as a carer to know that other people are going to do these things sensitively, respecting your loved one as they do it, would help lighten your load.
Treat the patient as an individual, so that there is an individual plan, and a patient or a carer will feel that they are not being treated as just another body.
Sometimes you have to feel like the protector of the patient with healthcare professionals who, are busy people, but they see just this patient who needs this. They don't see the person.
I think plain English language is really, really important. Completely understand that medical professionals will talk in their own language to each other, which is absolutely fine. You need to bring that language down a level so that the patient or the carer can walk away from that conversation confident that they've understood what is being said. Very often that's not the case.
Help carers to help their loved one when it matters by sharing information. Information is power. Information helps you make the relevant decisions in a timely way when you need to, not when it's too late.
Asking for a copy of the letter that's going to GP, I think that would make a massive change. Write that letter in easy to understand language.
Sometimes as a carer, you don't always get the information from NHS doctors, whoever looking after them. They'll only discuss it with the patient and not you. They don't tell you a lot of things that you need to know. So I think more clear, open conversations with those people looking after your loved one about what's going on.
I understand that they have to keep that confidentiality. But if a carer actually asks for that information so that they can best support the patient, then I think that disclosure, should be upheld.
Don't tell a patient bad news when the family have told you not to tell them bad news on their own.
If you're asking for information, if you're asking for help, if that person you're asking can't give you that information or help, then the healthcare professionals making sure that they pass that on.
Signposting to other services being operational in your area in spite of your treatment being in another area.
I think helping to manage expectations. I think sometimes you have a clinic appointment and it's, we'll see you in 2 weeks. But at other times, you literally don't know what's happening the next day, what's the next step. And all of a sudden, there is no plan, and there should be a plan.